Breaking news. Rural America have been suffering from higher rates of cardiovascular disease than urban populations. Unfortunately, this is due to rural populations having less income to pay for healthcare, less education regarding healthcare, and fewer options for medical care. And the overall cost of medical care due to the higher number of patients and the smaller number of providers. What is the creative solution that we have developed to eliminate the health disparity among rural Americans? To reduce the high rates of cardiovascular disease, to consider advocating for new public health policies that would bring an incentive for medical centers to offer telemedicine appointment. Telemedicine is especially beneficial for people who live in rural areas. New public health policies could provide doctors an incentive if they treat a patient who is at risk. Current patients would be able to keep their insurance at the same payment level, since insurance companies are not able to raise their rates based upon a client's medical condition. Medical providers would be able to accept more patients from rural areas due to the incentive, and the gap in the cardiovascular health of people from rural areas compared to urban areas would decrease over time. New policies would increase the availability and rate of people using telemedicine, and the quality and number of people who receive care without inflating the already high cost of medical care. As part of the creative solution, we will be introducing telemedicine to the rural population, which would greatly benefit cardiovascular health and the overall lives of those who live in rural areas. Telemedicine will eliminate the costs associated with in-person medical visits, and it would allow patients from most demographics more access to specialized medical care. For many who live out in the country, specialized medicine is not always available. Being able to see a cardiovascular specialist from the comfort of a living room is much more convenient than driving or possibly flying to the nearest specialist. Access to a healthcare professional at home would also alleviate the income loss from having to take a day or two off of work to travel to see a doctor. According to the USDA, 16.3% of America's rural population lives in poverty. This is nearly 10 million Americans. Individuals who live in poverty rely heavily on their full paychecks to afford to live, while a person would stay to miss at least one day of work just to see a doctor. Half a day's pay is better than no pay. For the Health Communication Plan, in order to enact laws that increase the number of telemedicine appointments, the solution must be marketed to both physicians and people living in rural areas. Social media is a great way to target both of these audiences. Physicians need to know how telemedicine is an option to see patients. The solution should be displayed on popular social media sites that have a high concentration of physicians. Examples of these websites include Sermore or Doximity. These are social media outlets meant specifically for doctors and other healthcare professionals. Doing so will open up the possibility of providing their services to rural area residents through telehealth. For patients, the Pew Research Center found that most popular regular use social media sites are Facebook, with 69% of American adults using the site, and Instagram, with 40% of adults using it. Advertising telemedicine appointments as a potential solution to eliminate the disparity of health providers in rural areas on Facebook and Instagram can lead to more people who advocate for incentive-based public health policies that can increase heart health in America. The American Heart Association is a national nonprofit organization that focuses on funding research on cardiovascular disease and related health issues, educating children and individuals from rural areas about cardiovascular disease, and reducing deaths in America that result from cardiovascular disease and stroke. The American Heart Association actively gives back to communities through education initiatives, elevating quality of health care, and advocating on changing public policy regarding healthcare. According to the CDC, cardiovascular disease is the first leading cause of death in the United States. It is a cause of disability and associated with many other diseases, including diabetes, high blood cholesterol, high blood pressure, obesity, and smoking. It is also one of the biggest contributors of expensive medical care and high insurance prices. Higher rates of cardiovascular disease contribute significantly to the unaffordable insurance rates in the United States, which leads to a demographics of people who cannot receive medical treatment at all. Treatment for rural populations is much more expensive and much more limited due to the lower number of specialized healthcare providers and higher number of patients. Rural populations are also making progress slower than urban.